What is polyp removal during ulcer endoscopy? Have you ever wondered what happens during an endoscopy when doctors find polyps while checking for ulcers? Polyp removal during ulcer endoscopy is a procedure where doctors identify and remove abnormal tissue growths called polyps from the lining of the gastrointestinal tract. This typically occurs while they are examining for ulcers, such as peptic ulcers, using an endoscope. An endoscope is a flexible tube equipped with a light and camera that allows doctors to see inside the digestive tract, including the stomach and the duodenum. Endoscopy plays a crucial role in diagnosing ulcers and assessing their severity. However, if polyps are discovered during this examination, they can be removed right then and there. This is important because polyps, while often benign, can lead to complications like bleeding, obstruction, or even cancer if not addressed. The actual removal of polyps, known as polypectomy, involves using small instruments that pass through the endoscope. One common technique is to use a wire snare that loops around the polyp and cuts it off. Sometimes, doctors use electrocautery, which is a method that applies electric current to minimize bleeding and destroy any remaining tissue at the base of the polyp. For larger or flatter polyps, a method called endoscopic mucosal resection may be employed. This technique involves injecting fluid beneath the polyp to lift it away from deeper tissue before cutting it out, ensuring a more complete removal. Polyp removal during ulcer endoscopy is generally a minimally invasive procedure performed under sedation. This means patients can undergo diagnosis and treatment in one visit, which is convenient and reduces the need for further procedures. After the polyps are removed, they are sent for pathological examination to check for any signs of cancer. This procedure not only helps with immediate concerns, but also prevents future complications related to ulcers caused by polyps, such as bleeding or obstruction. In summary, polyp removal during ulcer endoscopy is a safe and effective way to address abnormal growths found during ulcer examinations. It aligns with current medical guidelines for managing peptic ulcer disease and related conditions. Always remember to consult with healthcare professionals for personalized advice regarding any medical concerns.